Welcome again. We're at the dental offices of Dr. Norman Bryan and Dr. Anjana Gupta, and we are here talking about dental wellness and dental medicine. And Dr. Gupta, last time we met, we had an enjoyable time talking about wellness and how it relates to dental health, and there are a lot of associations there. It was a good thing to talk about and a good thing to review occasionally, isn't it?
It sure is. I don't think people can hear it enough how important it is that regular checkups and seeing the dentist, on a regular basis is something that everybody needs to be doing.
Absolutely. And folks, you need to come in here and see Dr. Gupta. We'll talk to you again next time about some of those issues. But right now we want to talk to Dr. Norm Bryan about going a little bit further in dental medicine. And doctor, for years you have specialized in TMJ. You've specialized in sleep apnea, things that go beyond just the normal dental care.
That's right, Craig. My expertise is in that field. Headaches and areas, neck and shoulder pain. There's areas that people don't really think of the dentist to see. And because the jaw is related to many of the muscles in the head, neck, and the only major joint that actually functions, that moves, and the teeth obviously being associated with the jaw, like a door stop would be with a door hinge, we often see problems with the jaw that may include headaches, neck and shoulder pain, things not normally related to the dentist. Yeah. So this is our diagnostics room where we see patients like that, and we can take them through the full gamut of obviously x-rays, educating them on what they have, what we see. We do muscle testing, and there are several tests that we use to determine whether these patients actually do have a problem.
You have a couple of demonstration type devices here and a diagram even. Can you maybe touch on that, doctor?
Well, we think education is extremely important. We really want the patient to know what we see and what possibly can be going on in their bodies. And we use several little tools here to try to explain to them what we see or what may be the problem. There's several things, diagrams, as you can see here. We have some anatomical diagrams to show them musculatures and so forth to try to explain exactly what we're looking at. TMJ, sleep apnea, snoring. Many of these things are very closely related to the dentition, to the jaw, the musculature, and these are all things that we are pretty strongly involved in here.
I was going to ask you about that. If a person does suffer from TMJ, and I'm going to have you explain what that is exactly here in just a bit, but if someone does have TMJ issues, likely then will they have other issues like sleep apnea? Do you find that closely associated?
Very much so. We have possibility of migraine type pain, a lot of headache, chronic long-term headaches are associated. When we hear the word muscle tension headaches, most of the muscle tension that we see is associated with those muscles that control the jaw. And so consequently, people again overlook that, may look at medications where possibly if we find the root of the problem, we can solve that where they won't need to take medications. And that's kind of the thing that we're looking for, is what can we do to rectify the problem so the patient isn't dependent on medications, some of them that obviously aren't good for them.
Doctor, I think one of the concerns and maybe one of the fears people may be watching right now when they come to a dental office is the fear factor. What you're talking about here, I know firsthand, doesn't involve a lot of pain, and there shouldn't be fear associated with this whole process. Should there be?
Not at all. Our goal is to alleviate pain, and many of the appliances that we use, similar to retainers, are what we're talking about that will really make the big difference. So again, this is an educational thing. Our first step in here is to try to show them what we can do for them, what it's going to be as far as the overall treatment plan is concerned, what we expect that to do for them. So there's no real pain involved. We're trying to alleviate that pain.
And we refer to the ailment or the condition as TMJ, but again, Dr. TMJ stands for, from a doctor's perspective.
Everyone has TMJ. It's a temporomandibular joint. Okay. What we're looking at is a dysfunction of that joint, and there's several reasons why that may be. And that's what we are in this room to find out about.
Okay, this is room number 6, as we call it here, as laymen would refer to it as room number 6. But doctor, thank you very much, and we'll talk more about dental wellness and specifically dental medicine maybe next time.
Thanks, Craig.
All right, Dr. Norman Bryan and Dr. Anjana Gupta here on our wellness segment on Fresh. Again, if you'd like to find out more information, you can go to our website at myfresh.tv or log on to the doctor's website on the screen. We'll be back in just a moment, so stay tuned. The American Countryside Farmers Market is your one-stop destination in northern Indiana for living well and enjoying every moment. Fresh meats, even buffalo, produce, baked goods, and treats, artisan breads, cheeses, and much more offer you the kind of living well you can take home with you. The market's also a meeting place for family, friends, businesses, and shoppers. The American Countryside Farmers Market, located just off the 20 bypass in Elkhart. Come visit this week or log on to americancountryside.us. We are back here with Dr. Norman Bryan. And Dr. Bryan, we just heard about some of the issues concerning TMJ, sleep apnea. What are some of the devices that can aid in getting a person a little relief along those lines?
Well, there's a myriad of different appliances available depending on obviously what's wrong with the patient and what we see with our first diagnostics. Depending on whether we see a patient that has an internal derangement of their joint versus a muscular problem, versus maybe that have a sleep apnea problem. There's like I say, a whole quandary of different appliances available that we can use to cover the bite, to change the jaw position. There are appliances that we can use that will fix the position of the jaw at nighttime to stop snoring. And there are some kind of exotic appliances that we can use that would actually eliminate sleep apnea or reduce it significantly. So there's several different appliances that we use in conjunction with TMJ or sleep apnea that we find extremely effective. Whether we're going to solve some problem 100%, it's more, can we manage a problem? Many times people expect a cure, and like arthritis, you can't cure it, but you can certainly manage it. And this is one of the few joints that we can really improve the situation significantly.
You can improve, and you do have documented cases where things have been reversed, correct?
Oh, absolutely. We're very fortunate that we have a lot of experience doing this, and we've got lots of nice testimonials of people that have really had a change of their entire life as far as what these appliances can do for them.
Life-changing information here with Dr. Norman Bryan. Doctor, thank you.
You're welcome, Greg.
Go to that website on the screen and find out more. We'll be right back.